Hey everyone, and welcome to another episode of SuperSoul Boulder. Happy SuperSoul Boulder, SuperSoul Boulder. I never even thought about like a Super Bowl. SuperSoul Boulder. I'm your host, Dr. Lara Johnson, coming to you live from Boulder, beautiful Boulder, Colorado. And I am physical therapist and founder of Yellow Brick Physical Therapy here in Boulder. And on SuperSoul Boulder, I like to talk about all things mind, body, health, and wellness because I am on a journey to help as many people as possible experience sustained freedom of movement with confidence and ease. Hey, Carlos, great to see you. Hi. And by that I mean, I came from a background where I was so into exercise and health and movement, and those are all wonderful things. And sometimes some of us, I don't know, you guys tell me if you've experienced this before, some of us can take that a little too far. Hey Dan, hey Chris, can sometimes take that to the extreme, and sometimes people take that to the other extreme and have a harder time being motivated. Others of us are highly motivated and have a harder time balancing. And I had a friend this last week ask me what my take was on Boulder as a city, as a place, and I think that Boulder, and I just think it's interesting, but so no judgment about it one way or another, but I see Boulder. I grew up in Colorado, and I was in Boston for about 6 or 7 years. I worked in exercise research and went back to for my doctorate in physical therapy there. But Boston seemed like a city full of like people very work-oriented and very extreme about getting to work and working really hard. And I moved back to Colorado and to Boulder, and it felt like people were on the extreme end of playing really hard, like to be outside, like to be in the sun. And I just see some of those extremes too. So as we talk today about this topic of movement is so wonderfully healthy unless it's hurting you, sometimes I can't help but think of some of the extreme ends that create that are both the fact that movement and exercise is so wonderfully healthy for us in many ways, and we'll talk about that, but not if it's hurting us, not if it's hurting you. And so we don't want to get too caught up in the extremes is one overall message here, such that we, one, don't get to see the benefits of that health through exercise, but we also don't want to push the exercise so much that it ends up hurting us. And believe me, I did that for years. So part of that is because I as some of you may not know, before I was a physical therapist, I studied health and exercise science. I grew up as an athlete. I knew I was interested in how the human body works, but I knew I wasn't interested in prescribing medicine or going to med school or what else? But then I was not stumbled upon. I was informed of the field of exercise science and realized, oh my gosh, I could prescribe exercise. I could help people, love and value the benefits of exercise. And through that process, I got to discover how much more beneficial it is than I ever knew. I knew it for myself. I knew what I loved and enjoyed about it. But shout out to Wake Forest University and their health and exercise science department. When I was in my master's degree there, I really got to see through some of the research studies going on how wonderfully healthy exercise is for us. We know this, but some of the ways that this is really shown is like exercise is so good for our hearts, right? It builds the ventricular walls of our hearts to be a little bit stronger, to be able to pump blood more strongly, more efficiently, more effectively. We see this in cardiac patients, those who've had a heart attack or heart disease and need exercise. It helps them actually get stronger in their heart. And we see this with the brain. Exercise is so healthy for our brain and bringing oxygen up to it. Those of you who exercise a lot know that, know how maybe you feel how you can think more clearly. But we also see in patients with Alzheimer's how exercise, like moderate to vigorous exercise regularly is what can reduce the progression of Alzheimer's. So we know how exercise is so healthy for our hearts, for our brains. So my master's thesis, I haven't thought about this for a while, so my master's thesis involved some studying some study or like a literature review on mobility disability. So exercise can help, say, older adults feel more confident, have more self-efficacy for their daily activities, for walking around outside. And so we can, these are examples, clinical examples, but we can offer them for everyone. And then we also know that exercise is so incredibly beneficial for people who are struggling with depression or anxiety. And we get out in nature, and you've experienced this for yourself, all these health benefits to exercise. And I got to see them up close and personal in all these awesome exercise research studies. It helps people with weight loss and maintenance, which can reduce the incidence of osteoporosis in people's knees, or osteoarthritis rather, in people's knees, for example. And while on that topic, it can help people, reduce the impact, reduce the impact of osteoporosis by having high impact activities and creating more bone density. We also know that even in older adults, strength training can improve someone's muscle hypertrophy, as in it doesn't matter what age you are, but muscle hypertrophy can occur at any age through strength training at the same kind of percentage as someone who's younger. And so hey Jen, hey Caitlin, oh great to see so many familiar names popping up. So we know how great and beneficial, you guys can definitely pop in comments, my yogis out there, breath control, there's so many amazing benefits of exercise, and I feel so fortunate to have been a part and to experience that so much along the way, because I enjoyed it and loved it and all these things. It brought me confidence, brought me friendships. So there's all these ways that exercise is beneficial, and that's why I loved studying it, until I got to a point, especially personally, where I went, but what if it's hurting you? Don't you find sometimes we can go, oh, it's so healthy, so if I do more, then maybe I'll be healthier. If I do more running, if I do more swimming, if I keep it all going, if I do stretching and weight training and all this stuff, yoga and everything, and Pilates, and let's add it all in there. Maybe I'll be even healthier. And sometimes, I don't know about you guys, sometimes it can feel like an overload. And then so that's one end of a spectrum. Like, let's do everything and go, reach the farthest places in our abilities and see what our genetic ceiling might look like. So that's one extreme, which could hurt us. And there's another extreme of the spectrum where some personalities, I work with people on either end of the spectrum and everywhere in between as patients on a regular basis. There's the other end where it's hard to be motivated and I don't want to go exercise, or maybe people haven't found something they enjoy, or maybe they're so bogged down by life, by their kids, by their job, that they just have lost a routine and lost the enjoyment and haven't found what works well for them. And there's everything in and along that spectrum as well. And don't you feel like in our lives we kind of go through different phases of that spectrum? And I think that's fine and natural and normal, and it's kind of finding our way back to what works for us in each phase and each part of our lives. So I was on this path of exercise science, and yes, and this is all great, unless it's hurting you. And this is what drove me farther into the field of physical therapy, because then sometimes for those of us who maybe push the envelope and like to see what that ceiling is, injury is, I don't want to say inevitable. Different bodies are a little bit different, but when we're riding that edge and that line, we're really risking, or even overtraining can bring us to the risks of injury. Our bodies can only withstand so many forces if we don't have any forces so many forces on our body. And then there's also the factor of nutrition and recovery, and are we balancing all those things? And then in the end, we can get injured also from chronic problems, chronic patterns that accumulate whether we're exercising or not, from sitting a lot, from standing, from slouching, from the repetitive kinds of exercises that we do. And then there's, of course, traumatic kinds of injuries, say, for example, from skiing or snowboarding, or from, falling or mountain biking, all sorts of, examples there. So there's that spectrum, right, of individuals, whether they're interested in lots and lots of exercise or maybe not a lot. And then there's everything in between. And what I was, interested in talking about today is that is that movement is so wonderfully healthy, like I just talked about. Hey, Ryan, there's all these benefits for our brain, for our heart, for our, psyche, for our ability to be mobile for a long period of time till we're, till we have quality of life throughout our various ages as we age. But again, not if it's hurting you. So exercise is beneficial. And this is what led me into the field of physical therapy. I didn't initially set out on my career path interested in becoming a physical therapist. I was interested in learning about the human body and how it worked. And that led me, and I was an athlete, it led me into exercise science. But then I got to this point, well, how do we keep people moving? How do we keep people moving? Because exercise is so beneficial. How do we keep people moving? I think largely by learning how to prevent injuries as much as we can. We're not always going to be able to avoid all injuries, but we can know how to read our bodies. We can learn how to be more balanced in the activities that we do. If we do a lot of repetitive exercises, a lot of repetition, we're going to need to do some things that balance that out. Lengthening, elongation, stretching, decreasing inflammation, things like that. So not if it's hurting you. And how do we then, I have to look at my notes because my brain's a little all over the place, how to know the difference? How do we know when we're overdoing it or underdoing it? Hey, Milo. How do we know that? Do we get caught in our own goals and interests to the detriment of the health of our body? Whether that's in cycling for a long time and putting a lot of hours and miles in versus getting caught up in our work and our families and taking care of other people. And here again are the ends of the spectrum, and there's a lot of room in between. But how do we know the difference and courageously walk the line between what is maybe too much and what's maybe not enough? But that leads me into this question of too much and not enough. If you've ever felt in your own person like you're not enough, it makes me wonder, how often is that driving the striving nature of doing more? And some of us feel like we're too much. And I wonder how much that drives another nature of not doing as much. And is it all about doing even? And what if we take a little bit of a closer look at why we do the things we do, why we follow those patterns, why do you push? Dan says we all have our goals and limits and different personalities. It's exactly true. Addictive personalities can really go to those extremes and I want to do more and push more. Other personalities are driven by maybe proving something to others. So I think it's important to see what's driving you. What is your motivation? Is it from outside of you or is it from inside of you? I think that sometimes we think it's coming from inside of us. If we look a little more closely, we might find we're looking for approval or achievement because of some other external factors. And they may even be hidden as internal factors, but check it out for yourself. Because if we're driven by proving and striving, then what about just being able to be where you are? Isn't that okay? We don't always have to be pushing forward. I'm kind of anti some words lately. I'm anti pushing through for sure. Now personally, now that I feel that words are really important. So personally, I feel very much against a pushing through kind of nature because I did that for so long. It sounds to me like pushing through the end of a race or pushing through the end of a degree program or pushing yourself despite what anything in your body tells you is not good for it. And I don't actually think that's the healthiest way to go. Now I see how we can we can go beyond our limitations. I get it, I really do. What if instead of pushing through, we stay with? What if perseverance, instead of meaning pushing through, means staying with something that's really challenging? Staying with the feeling of something going on in my body. What if the hardest thing you could do, if you're the kind of person who's got to push through all the time, is to not do that? What if the hardest thing you could do, if you're someone who doesn't like to get up and move, is to do that? I think so much of what's best for us in terms of finding where that balance is, finding how to know the difference between too much or not enough, lies in who are you, what are your particular patterns, and what holds you in those patterns. And in balancing, we've got to bring the pendulum more in the middle rather than swinging wide from overdoing, or maybe far underdoing, right? So there's some middle ground to maintain, and it doesn't mean it's easy, and it doesn't mean it doesn't sometimes swing a little bit, but I think that's where the balancing occurs. If we swing one way, we might need to come back a little, keep ourselves in check, and that's how do we keep from, hurting ourselves? That's one way. It's one way. So movement, exercise is incredibly healthy for us in so many ways. And then not if we overdo it. I talk more about that because that's the culture put myself into, the personality I've had. Again, there are other degrees of that and the other parts of the spectrum. But for some of us who tend to do a lot and love exercise, and that's okay. It's just that can hurt us too. I see it all the time with patients, and then it can be very frustrating. So one way we can not avoid, but keep the frustration at bay. Not have a big swing of, I did so much and now I have to stop because I'm injured. Let's not get to the place where you have to completely stop because you're injured. Sometimes it's going to happen, but how about modify? How about pull back a little? How about read that a little bit more? For me, that's been a challenging process because for me, it's a little easier just to go and move away, like leave the house, go work out, go to the gym, go run. And so it's taken a process to come back to being more balanced, doing a little bit less. And a lot of the patients I've worked with, that's a similar, again, not all of them, the patients I've worked with that are very, have goals in athletics that they want to achieve. I get that, and that's great. And if we can learn to ride those waves a little bit better, we just might enjoy the process that much more. And that's really the essence of exercise and of training, I believe. The essence of training, essence of exercise is enjoying the experience, enjoying the feeling, the process of development and consistency allows your heart to get stronger, allows your brain to have oxygen, and on an ongoing basis, rather than the ups and downs of extremes, of pushing too much and then stopping, pushing too much and then stopping. We'll actually go a lot farther if we're more consistent, right? Yeah, Dan says many people are happy with 30-40 minutes of exercise a day. Good there, but yeah, good. And maybe we can have that, different cycles of our lives. Maybe progress a little bit more in sometimes, and maybe be okay with a little less other times as we phase in seasons of life. So it's a topic that's near and dear to me because as I look back upon why I do what I do the way I do it, it really did begin with this movement is so healthy, exercise is so healthy for us, and then hitting this kind of sticking point of I kept getting injured and I kept seeing people I cared about get injured. Well, how do we keep people moving? Let's help keep them from getting injured and stopping, or that frustration. And I'm the first one to say injuries can be blessings in disguise. So many times we get to learn from an expert or learn in ourselves how to deal with that, how to handle that, how to better care for our bodies. So that's okay too. That's part of the process. But in in the interest of knowing the difference, my take, and you guys feel free to comment or share, is learning to feel the sensations in our body. You could be running fast, you could be riding long, and still have more awareness. Not only have the awareness, but also be able to act on that in ways that are healthy and encompass all of the areas of life that you want to have time for. I know in the times when I was really serious about running and spending a lot of time in, oh, thanks, Carla. That's the same. Injuries can be blessings in disguise. I have a couple stories about that. I have lots of stories about that, but oh no, I bet I lost my train of thought. In the knowing the difference and feeling, having the awareness in your body allows us to be able to decide if it's appropriate on this day to progress or maybe hold back. And maybe we have to find that out in the journey. You know, it's a learning process. Yeah, injuries can be blessings in disguise. I had one quick story. I had a stress fracture injury my sophomore year of college, so the end of cross country season. I ended up spending the whole indoor season in a cast and crutches through Christmas, went back to college and was on crutches and in a boot. And I was in the pool every day. I was really tenacious. I was like, okay, I'm going to do every workout that the team does out running, I'm going to do in the pool. I became a very good pool runner. In fact, I teach the class before COVID hit. I teach water running once a week in an outdoor pool. And anyway, so fast forward, I went to grad school at Wake Forest, and I got to do my one last season of indoor track during grad school because I had that redshirt season, and it was like a bonus season. And I also spent that time in the pool finding out a lot about myself. I pool ran, and I was in the weight room a lot, and I crutched around and all kinds of stuff. So it can be a blessing. And I see this with patients all the time too. One patient I have right now who's in high school with her whole track season, she was so gearing up for track season, and then it got canceled because of COVID and the stay-at-home orders. But it turned out to be great because she had this time to not push herself. And what we got to find in that time working together is not only relieving the pain of the problem she presented with initially, but as that finally resolved fully, then the original injury that she had completely forgotten about came about, and now that has been resolved. That has disappeared, and it's like the most beautiful thing, because without the time and space to allow the body to heal the way it naturally does, we might just be covering it over all the time, covering it over with strengthening, covering it over with our exercise. So there's a time and place for all of it, and it really is, in my humble opinion, a balancing act. And sometimes we will want to be progressing, pushing, and going for a particular goal. And sometimes we've got to maybe hold back and allow and see, wow, amazing things can come from that too. Carlos says, seems to be the only way some people listen to their bodies in order to keep that balance and harmony within. Yeah, with injury, I think so. It might be a really important learning experience. It was for me. And it led me to become more interested in the body, in injuries, in dealing with that. And that's been a beautiful and a challenging road, because I never wanted to be injured. But it also has been part of what allows me, a big part. My mom always said this. I was like, I'd rather not be injured. But it really has been what's allowed me to relate to people, to connect to people, and to know what they're going through, not just physically, but also personally. Missing the things they love to do, missing your friends and groups and track practice, or the things that we love about activity and exercise. That's not just about the physical element. There's a lot of other things that go along with it too for a lot of us. Maybe it's getting out and seeing sunrises or sunsets, and so we feel like we're missing. But during those periods, we can go inward, and as much as, just like you can become more aware of what's outside of us when if we're outside exercising or around us, or we can be more in tune with our bodies even during a phase of injury. And I like that comment about keeping that balance and harmony within. Yeah, I think it's a good goal to go for. A little cautious about goals too. We can hold them loosely. I had to mention that last time. So yes, movement is wonderfully healthy for us, and I think it's great to remind ourselves that all the ways that that's true in our brains, in our heart, the heart muscle, in our physical muscles, and our bones, our nervous system, and our health, and our ability to perform and become very dynamic in our bodies, right? And have friendships, and be outside in nature, and see sunrises, and feel ourselves get stronger, or feel ourselves get faster, or feeling free. And there's that other side that can come too, and riding the wave becomes very important. So movement is very, very healthy unless it's hurting us. And there are ways that we can keep that balance and harmony within in order to not push ourselves to the point of not being healthy, not being kind to our bodies, expecting so much of our bodies that we're not giving it what it needs, which might be more rest or more exercise, or more fuel, all sorts of things, more love, more connection. We need all sorts of things as humans, right, to be truly healthy. And there's a big, I think, dynamic balancing act. And so we also want to allow time for the other things in our lives that allow us to also not hurt ourselves, right? Not spend so much time in one specific area that we hurt our relationships or our other areas of our lives. So some food for thought. Please let me know what you think. That's what I got for tonight. I leave us with this for this week. Just let's, I invite you to consider in what ways is exercise healthy for you, and in what ways do you sometimes take actions that hurt you without judging it. Just like become aware and see, and what might you do to be more balanced and in harmony. I like Carlos's word there, harmony within. Yeah. And how can we then courageously walk the line or ride the line between those two extremes, too much and not enough. And I say courageously because it's easy to just go with what we're used to. The more courageous action often lies in doing what's right, what's best for us or others. Thank you so much for joining, for watching. I'm Dr. Lara Johnson from Yellow Brick Physical Therapy in Boulder, Colorado, and I so appreciate you coming on and joining this conversation. I'd love to know what you think and what your experiences are, and to open up these discussions on a deeper level. So it's about our bodies and our lives, right? And so much more. Those are my areas of main interest and how they connect. So take care of your body and take care of your life. Have a great Monday, and I'll see you next week. Bye.